I'm going to talk to you about what's new in cardiology today. Back in 1930, Claude Bernard discovered the procedure called cardiac catheterization and angiography, and then it was perfected in the human by Vernon Forsman. What that is actually putting a catheter inside of the femoral artery and then passing through that catheter a wire and then another longer catheter like this into the aorta and then up to the level of the heart. And with this catheter is hollow. It's got a hollow tip. And when it gets to the level of the heart, it gets positioned where the coronary artery is. Now there's two coronary arteries, the left and the right. So there's going to be two catheters, one that fits the left, one that fits the right. And this procedure was perfected by these people I mentioned. Since then, there's been a new procedure that's called radial artery catheterization. And why would you want to go through the radial artery? I'm going to have my medical student present her hand here. So why is it better to go through the radial artery than through the femoral artery? Because with the femoral artery, there is a small but finite risk of bleeding. The risk of serious bleeding is on the order of 1 in 1,000. Okay, serious bleeding meaning blood transfusions required. And in very, very rare cases, people have died because the bleeding was undiscovered in the pelvis. So unbeknownst to many people, 4 to 5 units of blood can accumulate in the pelvis before anyone notices that blood is lost. So by the time practitioners notice that the blood is gone, it's often too late. So the femoral artery technique, although standard and it's still very popular and it's used often, it's the radial artery that we've been focusing on in the last 5 years or so. In Europe, radial artery technique has been perfected for years, but now in the United States is finally becoming more popular. I'm going to give you a brief description of the radial artery technique. First, what we do is we check the circulation to the hand. The circulation to the hand is provided by two arteries, the ulnar and the radial artery. First, we check the patency of the ulnar artery. If the ulnar artery is patent, then we can proceed to puncture the radial artery. Then what we do is we puncture the radial artery and we get access. And there's a little wire that goes into the radial artery, okay? Over that wire, we put a sheath, okay? So the sheath is like this, and this is a plastic, basically two plastic tubings, okay, overlapping on each other. And the tubing is then advanced over the wire and placed right there at the puncture site. And then what we do is take out the inner plastic dilator and the wire together, and leaving only this plastic sheath. Now this sheath remains in place. We inject 3 medications, a blood thinner, nitroglycerin, and verapamil. Nitroglycerin and verapamil dilate the radial artery because a lot of times, very commonly, the radial artery spasms. So once that's done, then we put a catheter like the type that they have for doing femoral artery caths. Then we pass this catheter up this sheath, and then it's over a wire, okay? And the wire usually guides this catheter all the way up into through the hand, through the forearm into the arm, and then up into the heart. And that's how the radial artery angiogram is done. We can take the same pictures of the coronary arteries using the radial technique. And what's so great about the radial technique is, number one, it's not very painful, although it sounds like painful, but it's not, because we numb up the area. Number two is once all these pictures are done, then what we do is we take these catheters out, and then we take this out, and then we apply pressure. Now, there's a special band that gets placed on the puncture site, much like the band of my watch. And that band is placed over this area and kept there for 3 hours. Once that's done, after 3 hours, this bleeding will essentially have stopped, and the patient can then go home. While with the femoral technique, you got to wait 8 hours before that thing heals, And even then, you're still kind of iffy, and it may not completely heal, and sometimes it bleeds, and then they have to come to the hospital, okay, and hopefully they don't bleed to death. The femoral artery technique is fraught with bleeding, and although it's rare, although it's uncommon, when it happens, it can be fatal. The radial artery technique totally removes that risk, completely removes the risk, makes it very easy. The patient can get done, you're done, and you can walk right out after the procedure. You have to wait 3 hours to make sure, but at least she doesn't have to keep her leg straight and not move her leg, and it's very uncomfortable having an angiographic procedure because of that. But now you've taken all of that risk away, and it's so much better for the patient, comfort-wise and also risk-wise.